Well, let's get more information on all of this. I'm joined now by Dr. Peter Jüni. He's a professor of medicine and epidemiology at the University of Toronto, also the scientific director of Ontario's COVID-19 Science Advisory Table. Good to see you again this morning. Thanks for your time, Dr. Jüni.
Good morning. Thanks for having me.
So as we just spelled out, Ontario has announced students will return to school on Wednesday. That's 2 days later than originally planned. In your opinion, is that enough time to get schools ready, given other provinces, as we know, are pushing their returns to school by at least a week?
Look, if it's about getting things ready just for, HEPA filters and N95, I'm the wrong person just to understand whether these 2 days are enough. But, that's sort of okay. It's certainly going into the right direction. We just need to be aware of, we have other challenges ahead in addition that we really need to tackle there. The point is, schools, relative to what goes on in the community, in a restaurant, etc., are actually safer if we take these measures into account, and we just need to try to keep things as contained as we can, but we have a real challenge. That's the high community transmission.
What about the new rules on isolation and how that might impact students as well? What are your thoughts on that move?
Well, it makes sense given the situation we're in. We need to keep the society going, that you distinguish between fully vaccinated people and unvaccinated people, because fully vaccinated people should have a faster decrease in their viral load. So it makes sense, for essential workers, etc., and people who need to go to work. For school students, etc., one would prudently just say a longer time of isolation or quarantine would still be indicated, because we don't have any data yet, regarding Omicron, or not much data.
So if you were a parent right now trying to decide whether or not to send your children back to school on Wednesday, would you feel confident in this new plan, or would you be wanting a bit more time?
Well, I am a parent with a 7 and a 9-year-old among other children that we have. We have 4, and we sent them back to school on Wednesday, indeed, but they're fully vaccinated meanwhile.
Mm-hmm. All right. Well, let's talk about some of the other restrictions that we know Ontario brought in, to get your opinion on that. Ontario's announced capacity at large venues will now be limited to 50%, or 1,000. How important will these measures be, in your opinion, to stop the spread?
Again, it's a good start, but we need to be aware of that. We're still in exponential growth, and as long as we don't get these case numbers under control, it's a self-fulfilling prophecy. There will be a moment when our healthcare system will get overwhelmed. No, this doesn't matter whether we have a 50% decrease in hospital admissions, for example. We will just raise our numbers, and this will eventually result in challenges. So we would need to make sure that our case numbers become flat. It will be at a high level, but this would need to happen relatively soon, and then the measures we're seeing will most likely not be enough, despite the fact that people start to change their behavior, which is the right thing to do. It probably won't be enough.
We talk about tracking the case numbers, and how is Ontario going to do that now that PCR tests are not going to be available to anyone who wants one? It's very tough still to get a rapid test. So counting numbers in Ontario, other than looking at hospitals, doesn't really make sense anymore, does it?
Well, the challenge is now that the strategy also has changed. Of course, we were challenged before that we were undercounting dramatically. You can safely assume right now in this province, if you see a number, that it's about 5 times as many people who actually could be diagnosed if we were able to do that. But that's not completely unusual. Already before, only 2 out of 5 were diagnosed. That's internationally the case because of, just the characteristics of the virus. But right now, we really have a challenge, and we will not be able to fully interpret the numbers or the trends. Even we need to focus on test positivity, hospital admission, ICU admission.
All right. New Year's Eve. Let's talk about that. And rapid tests. Some people are happily heading out to a party knowing that they have rapid tests they and their friends could do. What is your advice? What are your concerns for tonight?
Don't trust them anymore when they're negative. First of all, it's safe to assume that right now we have about 5% of the population of Ontario who currently is infectious. So it's very difficult to deal with these high numbers anyway with a rapid test. If it's negative, you can't interpret it anymore. But now what we see yesterday, new data coming out, that rapid tests now with Omicron are only able to detect roughly 50% of the infectious cases out there. The other 50% percentages stay negative on a rapid test. And that's the problem. If you have a rapid test right now, it doesn't mean anything regarding that you're safe, to meet with other people. That's a blast from the past. This was okay for Delta, etc. And when the case numbers were low, it won't work anymore for Omicron. So don't use the rapid test for this purpose. It's not working. It's a fallacy now.
Wow. So are you saying forget about rapid tests then?
Forget about rapid tests if they're negative. If they're positive, they tell you, I have COVID. That's as it stays. If you have a rapid test at home and you had symptoms and you're 5 days after the symptoms, you do the test and it's negative, you have some reassurance that you're cleared, that you can go back, and if you're careful with self-isolation a bit, that you can go back to work, for example. But if it's negative, forget about it. It doesn't tell you anything anymore.
All right, some sobering advice for people as we head into yet another holiday weekend. Dr. Peter Jüni, we always appreciate your insights. Thank you for this.
Thanks for having me.
Dr. Jüni, Scientific Director of Ontario's COVID-19 Science Advisory Table.